Nutrition really matters in the management of Crohn's and ulcerative colitis. So, diet and nutrition have several roles to play in the treatment of inflammatory bowel disease. In the last 10 years, we have observed from large prospective studies that dietary components and dietary patterns may either increase or decrease the risk of developing IBD. In addition, we've learned that whole foods, diet components, nutrients may be associated with active disease, with inflammation, or with remission. And finally, intervening on those diets or changing the diets have been successfully used to induce remission, sometimes even in the absence of medications, although we would never recommend a sole dietary approach unless that is done together in conjunction with your gastroenterologist. Now, on the malnutrition side, between 30 to 80% of patients with IBD may encounter malnutrition at some point in their disease. And malnutrition is very common, and it can be associated with many outcomes such as poor energy, low muscle mass and function, increased hospitalizations and surgeries. So, identifying malnutrition and treating it with diet and dietary therapies and supplements when applicable can be really critical to improving outcomes. So, given this, nutrition is absolutely a priority to consider in managing your IBD. I tell patients in my clinic when they express their interest in diet that I'm excited, first of all, to hear of their interest in lifestyle therapies. Specifically around diet, I tell them that we think it works through different mechanisms and pathways than their usual biologic medications. So potentially, introducing diet therapies offers another avenue for successful disease management. I try and understand also what patients are trying to achieve with diet interventions. So first, many look for diet solutions to manage their symptoms. Second, others hope to improve inflammation. Some patients may have mild disease and are looking for non-medical strategies to explore prior to embarking on medical therapies. So we discuss for many patients that combination therapies using medical and diet can best manage their disease. But for some patients, diet alone may be an option, but that should not be undertaken without appropriate supervision and monitoring. So based on joint decision-making between the patient and myself, we arrive at the diet strategy based for that or best for that individual. Then this plan gets communicated to the registered dietitian who has experience in GI care. And then we arrange follow-up visits to ensure that this strategy is meeting with success.